The Trump administration says it is ending a bailout for insurance companies. But buried inside that explanation is the part seniors actually need to hear. Prescription drug plan premiums could go up for millions of Medicare recipients. And when Washington says it is punishing corporations, seniors need to ask one question immediately. Then why does the bill land on us? That is the problem with this story. The administration is framing this like it is standing up to big insurance companies, but the warning attached to the move says something very different. Medicare Part D is the prescription drug benefit used by tens of millions of older and disabled Americans, and the subsidy program that helped keep premiums down is now being allowed to expire at the end of the year. Officials say the change is expected to happen in 2027, and seniors will find out their new monthly cost later this fall. So before anyone celebrates this as some brave attack on corporate insurers, we need to look at who is actually at risk when the support disappears, because the administration's own explanation does not erase the impact. An official said the move will likely increase prescription costs and raise premiums for about half of recipients. That is the sentence seniors should not ignore. Not the political spin, not the fight over whether insurance companies benefited. The real issue is that seniors already living with rising grocery bills, rent, utilities, insurance, and medical costs may now be told their drug plan is going up too. And once again, Washington gets to argue about ideology while older Americans wait for the bill in the mail. Dr. Mehmet Oz, who now leads the Centers for Medicare and Medicaid Services, says this subsidy is no longer needed because the market is being stabilized. He argued that premiums will go up by less than $10 for most Medicare recipients, and that some people may even see lower premiums. But that still leaves the same question hanging in the air. If this is such a clean fix, why are seniors being warned about higher costs at all? Why is the answer not, no senior will pay more? Why is the promise not, prescription drug coverage will remain protected? Instead, seniors are being told to wait until fall to see what their plan actually charges them. And this is where the numbers matter. The government has been paying billions of dollars to insurance companies to help keep prescription drug plan premiums around an average of $36 per person per month. According to the health policy nonprofit KFF, ending the subsidy could raise premiums for some seniors by as much as $20 a month. Now, Washington may treat $20 like pocket change. But for a senior living check to check, $20 more every month is not nothing. That is $240 a year. That is medicine money. That is a utility bill. That is groceries. That is the difference between absorbing the cost or cutting somewhere else. And let's not pretend this lands in a vacuum. Healthcare costs are already one of the biggest fears for older Americans. Prescription drugs are not optional for many seniors. These are heart medications, blood pressure drugs, diabetes treatments, blood thinners, inhalers, thyroid medication, cancer drugs, and pain management prescriptions. So when a drug plan premium goes up, the problem is not just the premium, the problem is the chain reaction. Seniors start comparing plans, delaying refills, skipping drugs, splitting pills, or choosing between medication and another bill. That is what these policy decisions become once they leave Washington and hit a kitchen table. The administration says the subsidy was a bailout created after the Inflation Reduction Act, and Trump officials argue that billions were funneled to major insurance companies. That may be politically useful language, but seniors need to separate the target from the impact. If insurance companies were getting too much money, then expose it. If the system was being gamed, then fix it. If corporations were protected, then claw it back from them. But do not call it a corporate bailout while allowing seniors to face higher premiums on the back end. That is not punishing corporations. That is shifting pressure downstream to people who depend on the coverage. This is the part that should make seniors suspicious. Every time Washington says it is cleaning up the system, regular people need to ask whether they are cleaning it up or simply moving the cost. Because seniors have heard this before. They are told a program is being fixed. Then the forms change, the premiums change, the plan choices change, the coverage rules change. And suddenly, the person who did nothing wrong is the one spending hours trying to figure out why the monthly cost went up. That is not reform. That is confusion packaged as savings. Now, Dr. Oz also pointed to other administration efforts, including most favored nation deals and a policy giving seniors access to GLP-1 medications for $50 a month. But that does not answer the main problem. A promise about one category of drugs does not cancel out higher Part D premiums for people taking completely different prescriptions. Seniors should not be distracted by the shiny example. The question is whether their actual drug plan covering their actual medication list will cost more in 2027. So here is what seniors need to know. When the new plan information arrives this fall, do not just renew automatically. Compare your Part D plan. Check the monthly premium, deductible, co-pays, preferred pharmacies, and whether every medication you take is still covered. Call Medicare or use the Medicare Plan Finder before open enrollment ends. And if your premium jumps, do not assume you have no choice. Plans change every year, and this year the change could matter more. The administration wants to call this the end of a bailout. Fine. Then prove seniors are protected. Because if half of recipients are at risk of higher costs, this is not just a fight with insurance companies. It is a warning to Medicare beneficiaries. And the question seniors should keep asking is simple. If Washington says the target is corporate insurance, why are seniors the ones being told to prepare for higher prescription drug costs?